Well, it is the height of flu season, cold season. I don't sound the best myself. Now, aside from washing your hands, avoiding sick people, you can help boost your immunity by eating certain foods, taking vitamin supplements. But what works? What doesn't? What's preventative? What's not? Here to answer those questions for us is registered dietitian Amy DiCioccio from UConn Health Center. Amy, thanks for joining me.
Thanks for having me.
Well, let's talk about preventative measures first. So that's this section right here, right?
Correct. The biggest chunk of research about preventative medicine in both common cold and flu is centered around vitamin C. You're going to really want to aim for about 1,000 milligrams of vitamin C per day, which these packets provide all of that.
So that's self-encompassing, these packets.
Correct.
1,000 milligrams, would that be a large orange? Or?
Not even close.
No?
No. Actually, these oranges have pretty close to 100 milligrams.
Oh, my goodness.
So you need to eat 10 of them. It's kind of
hard. That's not going to happen.
Right,
okay, so
right.
let's go
it's
for one
kind
of
of
these.
hard. Right. And so then at the same time, you're also getting fluid, which is really good, because the best way to stay healthy is adequate hydration, rest, and healthy eating.
Okay, so when you're at work and you're just feeling a little crummy, this is what you need to do beforehand.
Right. The vitamin C research doesn't show any difference if you already have the symptoms, if you already have the cold and things like that.
Okay. Now let's talk about this section.
Yes. So this is if you're already there.
If you're already sick as a dog.
If you're already feeling the symptoms, it may be for a couple days. The chicken soup is what my mom always gave to me. But the research behind it actually shows that the comfort food makes you feel comfortable.
That's basically what it is. It doesn't ward off the flu. It just kind of eases the symptoms.
Correct. For a couple different reasons. If you're sick with the flu for a couple days, you haven't had solid food, you've had almost no protein, all of a sudden you get the chicken in the broth and then the chunks. Your body needs that protein, you feel better.
Okay, and this area here, the broccoli, the garlic,
right.
That sounds like it helps.
And it always sounds like it helps. I have broccoli here because it's another great source of vitamin C, but you want to make sure that you at least steam it a little bit because you're going to increase the vitamin C bioavailability if you steam it first.
And this is more for the flu.
This is, vitamin C again is more for prevention.
Okay, prevention.
The garlic is on the list of things that people think will work, but the research is not strong. Things like echinacea, zinc, more research needs to be done, and it needs to be more regulated.
What about a sore throat?
Sore throat, we'll move back over to tea.
Let's back right over.
Tea, I have a couple different flavors here. Adding honey to it can definitely be soothing. Chamomile is soothing and decaf. Also, mint can help settle your stomach. If you've already lost a lot of fluid, you want to make sure you're avoiding caffeine so you don't get more dehydrated. What
is something that you shouldn't be eating if you're feeling phlegmy? I would think dairy, right? Something that you should just kind of avoid to help.
Yeah, people tend to think that. Most of that is because of the coating feeling. You're already coated. You definitely don't want to do that. Again, staying adequately hydrated can cut through the mucus and make it easier to deal with.
Okay, any misconceptions with certain items?
I think what I mentioned before with the echinacea, which is huge, you have to be really careful because when oral supplements are not regulated by the FDA. So the ingredients may not be what you want them to be or what they claim to be.
And there seems to be something going around, but in different forms. We were talking about that. A lot of people here in our newsroom, I know, but you know, we're all talking about that. So sometimes when you're not really sure, I mean, obviously you want the comfort food, but again, preventative is key because then we don't even have to get to the latter.
You can definitely depend on 1,000 milligrams of vitamin C to help you prevent a cold. It's not a guarantee. Nutrition is never a guarantee in that sense, but it will help.
How about airborne? I know a lot of people take that.
A lot of people take airborne after they've already started feeling the symptoms. And again, vitamin C is only beforehand.
Okay. Sometimes it's just mental, right? You take it, you say, oh, I feel so much better.
Like the chicken soup.
Exactly. Amy, thank you so much for sorting it out for us.
Of course.
Okay, thanks.